Good day. This is Aladdin from Cohort 8 of our in-bridging program for internationally educated nurses, and this is my presentation on mental health nursing about psychobiological disorders. Psychobiology is the interaction between the brain, behavior, and the environment. It enhances our understanding to a wide range of mental disorders such as anxiety, schizophrenia, eating disorders, substance abuse, personality and mood disorders like depression and bipolar disorder, which is the focus of my presentation. Bipolar disorder is a chronic and lifelong mental illness characterized by an extreme manic and depressive episodes that last for a certain period. Symptoms of mania include an extreme elated behaviors which are often risky and injurious, while depressive symptoms shows severely depressed behavior like hopelessness, despair, and altered cognitive functions. Remember that either manic or depressive symptoms impacts a person's activities of daily living. There are three types of bipolar disorders: type 1, type 2, and cyclothymia. In bipolar disorder type 1, it is characterized by a severe manic episode that lasts about 7 days or manic episode that are so extreme that requires hospitalization. An extreme depressive episode usually appears separately and lasts about 2 weeks. Remember that the duration may vary from person to person and may last longer than usual. Other features may include mixed symptoms or the appearance of manic and depressive episode at the same time. Another one is the rapid cycling, in which a person experiencing at least four or more manic and depressive episodes within a year. While in bipolar disorder type 2, a person may experience an extreme depressive episode followed by an episode of hypomania or a less severe manic episode. And lastly, cyclothymia is when a person has a depressive and manic episode but are less severe and not long enough to qualify as hypomania and depressive episode. Management of bipolar disorders includes pharmacologic and non-pharmacologic treatment. Pharmacologic treatment is the use of medications such as mood stabilizers, antipsychotics, and antidepressants, while non-pharmacologic management involves psychotherapy or talk therapy and brain stimulation procedures like ECTs and repetitive transcranial magnetic stimulation. Bipolar disorder has no known cause, but studies shows multiple risk factors involved in the development of bipolar disorder. This includes genetics, which revealed that a person may develop bipolar disorder 10 times higher if a family member has a bipolar disorder too. Environmental factors like parental age at birth, infections, trauma of the brain are likewise predisposes the development of the illness. Moreover, study shows that changes in brain structures and disturbance in the biochemical processes of neurotransmitters plays a major role in developing bipolar disorder. Structure of the brain affected are the gray matter and the hippocampus. Study shows that there is a reduction of cortical gray matter in the frontal, temporal, and parietal lobes in both hemispheres, causes some issues in impulse control, senses, reflexes, regulation of reaction time, and problems of motor skills. This could explain the impulsivity and risky behaviors in manic episode and static episodes during depressive episode in bipolar disorders. Studies also found out that there is a shrinkage of the hippocampus which affects the regulation of emotional and behavioral responses. Sleeping problems, confusion, impaired attention and memory, and skills in problem solving, which could all be linked to major symptoms of depressive and manic episode of bipolar disorders. Neurotransmitters such as noradrenaline, dopamine, GABA, and serotonin were also found to be affected in bipolar disorders. A low level of noradrenaline signifies depressive symptoms, but an increase of its chemical metabolites were observed during mania, while a decrease in dopamine secretion causes mood changes, motivation, and exercise patterns, which are significant clinical signs of bipolar disorder. Furthermore, the GABA level is low during episode of depression, and relatively high during manic episodes. Finally, the serotonin was associated with suicide occurrence and aggressive behaviors. Although studies on bipolar disorder exist, the study samples were small and the influence of serotonin was not clearly explained. So this is my patient, Amarfela Chibe, a 30-year-old female. She is a black African who recently came to Canada with her parents, living in an apartment in Regina, Saskatchewan. She is a newly diagnosed case of bipolar disorder type 1. She has no known comorbidity, but her mother was diagnosed of bipolar disorder. She is a Christian follower and doing church services regularly every Sunday. Therapeutic communication techniques plays a key role in nursing process, especially during assessment where gathering data is crucial. We wanted to get as many pertinent data to create a comprehensive care plan for our client. Therapeutic communication techniques that allows us to do this are giving broad opening and active listening. Giving broad opening by saying, "What would you like to talk about?" signifies that a client has permission to choose and lead the conversation. This will allow the client to exercise her autonomy and choose the topic she wanted to talk about. While active listening involves showing interest in what the client is sharing, affirming that you understand by nodding and saying "I see" or "I understand" will allow the client to engage more in the conversation. Nursing problems identified in this case were risk for injury and risk for self-harm. Let's go over for the first one, risk for injury related to changes in cognitive function, such as evidenced by extreme hyperactivity and risky behaviors. My goal for this problem is the patient will determine factors that increases her risk for injury and will demonstrate behavior to avoid injury. Priority nursing intervention is to educate the patient about factors that increase the risk for injury and behavior to keep away from injury. The patient is expected to be free from injury and able to determine factors that increases risk for injury and demonstrate behaviors avoiding injury. And for her treatment outcome, the patient undertake her own self-care measures. The second nursing problem is risk for self-harm related to depressed mood, secondary to bipolar disorder, as evidenced by feeling of hopelessness, despair, and helplessness. Treatment goal for this problem is the patient will establish safety plans, recognize provoking factors, management plans, and crisis intervention resources. Nursing intervention includes providing safe environment by removing objects suggestive to suicidal thoughts, removing tripping hazards, and ensure belongings are within reach. The patient expected to establish safety plans and able to recognize provoking factors and coordinated to a crisis intervention resources. As for the treatment outcome, the patient display no signs of self-harm and threats of harm towards others. For the patient's pharmacologic management, valproic acid was prescribed to control her mood symptoms. Valproic acid is an anti-epileptic drug used in bipolar disorder as a mood stabilizer to improve mood by reducing manic episode. It is known to have interaction with neurotransmitter GABA by enhancing its effect. Patient education about valproic acid includes taking the medicine strictly as prescribed because crushing the medicine will destroy its component. Weight gain is a common side effect of valproic acid, so reminding the patient to watch out for her food choices is essential to promote balanced diet. Drowsiness were reported by some patients while taking valproic acid, so if experienced, avoid driving and operating machineries. Alcohol consumption should also be avoided because it can increase the drowsiness. And valproic acid is known to have a teratogenic effect, so if plan to get pregnant, talk to your doctor as soon as possible. After discharge, it is important to have a constant support either from a family member, friends, or people who have experienced the same, or professionals to keep help your goal on track. Here are some of the institutions you can go and check on. Mental Health Mood Disorder Support Group found in Regina General Hospital. The Canadian Mental Health Association Regina branch located at 1810 Albert Street, and the Adult Mental Health Clinic located at 2110 Hamilton Street. In cases of urgent and emergency care, you can reach out to crisis intervention resources like the Regina Mental Health Clinic and 211 Saskatchewan 24/7 hotline or the 911 urgent emergencies. And that concludes my presentation. I hope that you had acquired some additional information about bipolar disorder. Thank you and have a good day.